So we discuss the next guideline, that is 2017 European guideline for the management of chancroid. Okay, let us see about certain basic things. The cause of chancroid is the Haemophilus ducreyi, that is a gram-negative bacillus. It causes painful genital ulcer disease, that is GUD. It is now rare in Europe, but still it is common in certain Africa and northern India, etc. The risk factor will be the travel to the endemic areas or sex work. Okay. Now coming to the incubation period. Okay, chancroid has got a short incubation period, around 3 to 7 days. Primary lesion is in form of ulcer. There will be tender erythematous papule, which will form the pustule and it will form the ulcer. So painful ulcer. Here, please remember the feature of the ulcer. When you want to diagnose the differentiate the ulcer, you should know the features of the ulcer so that you can differentiate this from syphilitic ulcer or herpes related ulcer, that you will be able to differentiate. Okay, so that table is also there at the end. Okay, so typical painful ulcer will be, it will be painful, edges will be ragged, undermined, the base will be granulomatous, purulent, it is a soft in consistency, it may be single or multiple, and typical kissing ulcers. So if you get this word kissing ulcers, you think about the chancroid. Okay, lymph nodes, there will be unilateral painful lymphadenitis. Okay, so ulcer with lymphadenitis, chancroid. Okay, so 50% will develop buboes. Buboes may rupture spontaneously also. So probable clinical diagnosis likely if all are present, one or more painful genital ulcer, ulcer plus lymphadenopathy typical of chancroid. Syphilis you have to exclude, such as dark fluid or NAT testing, or serology you have to repeat after 7 days. Then HSV you have to exclude. Okay, so differential diagnosis will be genital herpes, syphilis, LGV, trauma and malignancy. Okay, so these are the differential diagnosis, and always test for HSV and syphilis also when you get such kind of presentation. So microscopy, what you will get a small gram negative rods, but it is low sensitivity and low specificity. It is not recommended. Okay, the organism is very fastidious. It requires a special enriched media. Sensitivity is less than 75%. The sample is to be taken from the ulcer base. It has got undermined edge. Transport is required in amines or Stewart medium, and incubation at a particular temperature and all that is required. Confirm diagnosis but does not exclude co-infection. Okay, so this will confirm the diagnosis culture but does not exclude the other co-infection. Then best test will be the NAT. So NAT is the best test, higher sensitivity than the culture, and it will detect the Haemophilus ducreyi, also Trypanosoma pallidum, HSV. Okay, but it does not require live bacteria. Okay, so this NAT is the best test. Serology is not useful in acute infection. So management, explain that it is an STI, bacterial disease and curable disease. There is increased risk of HIV transmission. Abstain from sex until the patient and the partners have completed the treatment. Symptoms result generally in 1 to 2 weeks. Okay, what is the treatment for this chancroid? Chancroid is a ceftriaxone 250 milligram intramuscularly given stat. Okay, and other alternative will be azithromycin 1 gram per hour. Okay, so what was the treatment of gonorrhea, doctor?
Ceftriaxone 1 gram single dose.
Here the same drug, but the dose is 250 milligram.
But azithromycin here, and there it was only ceftriaxone.
There only ceftriaxone was there. Okay,
Yes.
and here second will be the azithromycin 1 gram
Yes.
single dose. Okay,
Yes.
there are only 2 conditions where the azithromycin is given. Okay, here also the first drug will be the ceftriaxone, but the other will be azithromycin. And azithromycin alone is the first drug of choice in one condition, that is donovaniasis. Okay, that we will discuss when we will see.
Yes.
Okay, there the only first time azithromycin you will get as a first drug. Okay, here it has come as a first line, but the second preference. Ceftriaxone, okay. Next comes azithromycin. Okay.
Yes.
And only azithromycin, if you think, if they ask you donovaniasis, there is a azithromycin. Okay. And what we have seen, mycoplasma, doxy for 7 days and 3 days of what?
Azithromycin.
Azithromycin.
1 gram
Okay.
stat and then 500
500
milligram on 2
OD.
successive days.
OD for 2 successive days. Okay.
Yes.
Was that OD? I think it was OD only because total dose is 2 gram required. 1 plus 1.
Yes, 1 azithromycin 1 gram stat and then 500
500
milligram
OD for
OD
2
for
days.
2 successive
Correct.
days,
Correct.
total 2
Yeah.
gram.
Yeah. Correct. Okay. That is how you remember. So second line drug will be ciprofloxacin 500 BD for 3 days, erythromycin 500 QDS for 7 days. So safe in pregnancy will be erythromycin. Okay. So sometimes they can give you that the patient is allergic to ceftriaxone. Sometimes they will give that the patient is pregnant and allergic to ceftriaxone. Okay. Then here you will have to use erythromycin, not the azithromycin. They have not given. They have safe in pregnancy. I don't know whether this azithro we'll see if there is a pregnancy specific anything they have mentioned. Okay. Situation HIV positive. Yes. Pregnancy, it will be ceftriaxone or erythromycin. Okay. So go for ceftriaxone as a first. If it is patient is allergic, then go for erythromycin. Okay. That will be 7 days course. Okay.
Okay.
Children, ceftriaxone. Okay. If it is a HIV positive, then pregnancy again same treatment. Okay. So that finishes our chancroid. It's